Hello everyone, welcome to my channel. For those of you new to my channel, I'm Alan and I am a kidney dialysis patient. I have end-stage renal disease, which requires me to have dialysis until I am able to get a transplant, whether that be a living donor transplant or a deceased donor transplant, preferably a living donor transplant, due to my young age at this time. So I'm just gonna walk you through the process. There have been some questions about how does the machine work? How do I set up the machine for dialysis? And what does the process entail? Some people might have some questions about what is a fistula. I've gotten that question today, so I just want to make sure I go through step by step the process of me setting up for dialysis on my next stage Versi HD machine. Right now, my machine is priming. I've already put in a cartridge into the machine. I've attached my saline bag. I just need to do my setup for my attachments. But right now, I'm not going to do that. I'm just going to walk you through the process of me talking about what is a fistula while I wait for this machine to finish priming and all of that stuff. So, a fistula access. A fistula is an access that is placed by a vascular surgeon. So I have a vascular surgeon, Dr. Peticios, and a wonderful group at American Access Care in Queens, New York, who I went on the surgery and had a fistula placed. What they did, they attached an artery to a vein in my hand. So what happens is that artery is now feeding into that vein. So the blood is making that vein bigger. So for dialysis, you need a mature fistula. So it takes about 3 months for a fistula to mature. So you can't use a fistula until a vascular surgeon says it's ready for use. So I had that surgery placed, and this little thing you see right here, which is a surgery mark, which is called a stenosis. The estemosis is the surgery placement of where the fistula connection was made. So that my artery and my vein were connected here by the vascular surgeon, and it's feeding into a vein that is along my arm right here. So you see these marks right here? So these marks is my fistula access vein. So those were needles that I've placed during, my time on dialysis, hemodialysis. The needles have been placed into my fistula access right here, along here. So this is where my machine, when I do my my 15 gauge needle inserts into my fistula access port, there's 2 needles that are placed. There is the arterial needle, which pulls the blood from my body. And then there is the venous needle, which brings the blood in from the machine to my body. So at the same time, blood is being taken away from my body through the machine, through the dialyzer, and being cleaned in the machine and being brought back into my body via the venous access into my fistula. So that is what a fistula is. It's a access that is placed by a vascular surgeon. There are different types of accesses that can be placed for dialysis. There's also, when I first started dialysis last year, I also did hemodialysis, and I did hemodialysis in-center. So in-center hemodialysis, when I first started, was done via a catheter, a CVC catheter, a central vein catheter, which is placed on my chest area here, which is connected, I guess, to the vein and the artery in my neck, which is directly leads to my heart. So a CVC catheter is meant to be temporary. It is not meant to be a permanent access. Why? Because a CVC catheter can get infected. They tell you cannot get a CVC catheter wet, which means you can't take a normal shower You have to cover it up and all of that stuff, and you don't want to get a CVC catheter infected because CVC catheter leads directly to your heart. So the CVC catheter was meant to be temporary at that time. So I had a CVC catheter. So for about 3 to 4 months, I had a CVC catheter, and I, did in-center hemodialysis. Which at that point, when November, December rolled around, I was on what you call peritoneal dialysis. So in November of last year, I had a peritoneal dialysis catheter placed in my abdomen area. That PD catheter had a tube extending out with a PD catheter port that was extending out of my body, which connected to the PD catheter machine that I was using at that time. Now, a PD catheter is how I would describe very annoying. If you're not used to something being dangling outside of your abdomen for 24 hours a day, 7 days a week, and you literally have to do peritoneal dialysis every day. It's a dialysis that's meant where fluid, a PD fluid, which is fluid that you get from the manufacturer, from the dialysis center, that is shipped to your home, and that is then flowed into your body, into your stomach, abdomen area, and it dwells there for a certain amount of time. Maybe it could be an hour and a half into hour and 45 minutes, depending on the time it needs to dwell. And it's what the fluid is doing. It's basically supposed to be cleaning your blood and the toxins out of your body. So when it dwells there, it's pulling all of the toxins out. It's a sugar solution that's meant to pull the toxins out of your body, and it then drains off into a drain bag. And that's meant to occur several times during the night. So you usually sleep when you're doing PD dialysis or peritoneal dialysis. I did it for about 8 hours, in my beginning stages. Then it went to 10 hours. It gradually increased over my time on PD dialysis. I started in November last year. I ended PD dialysis in May of this year, in May of 2025. So only because my numbers for PD dialysis, my clearance levels for my toxins coming out of my blood was not great at all. It was actually nothing, negligible. Basically, I was not getting any cleaning from PD dialysis. So I had to get my CVC catheter replaced. I had to take matters into my own hands because I knew I had to transition in my head. I'm not getting good clearance. I'm feeling actually worse. So I had to get, a CVC, the PD catheter removed. I had to get the fistula access placed. That's what I meant to say. I had to get my fistula access placed, my PD catheter removed, because I wasn't getting good clearance on peritoneal dialysis. So I needed to switch over to hemodialysis. And I wanted to take my health into my own hands and not go in-center. In-center, if you've never been in-center dialysis is not for the faint of heart. People who are much older and, can't do the actual needles and the whole process of doing the home hemodialysis at home would most likely go in-center. If you're not used to inserting needles, you can't get over needles and blood and doing it on your own and being self-reliant, home hemodialysis might not be for you. But in-center dialysis, it is very draining, to say the least. You have to come there at a certain time. You can't do it on your own schedule. You have to be there at a certain time when they have a chair available for you to come in for the dialysis. You have to, you're there with a bunch of people in a room. And, a lot of people are screaming in pain because if you have never experienced dialysis cramps, trust me, It is nothing for you. It feels like your bones are cracking. Okay? Dialysis cramps, and I've had severe dialysis cramps in center when I went in center. When I say I've had severe, I'm talking about my stomach, my abdomen, everything, my chest, my legs, everything is just, the muscle is just pulling and in my body, and it feels like your bones are cracking. All right? And if you're not at a great in-center dialysis, the technicians, the nurses, they're not really paying attention to you because they're dealing with so many patients all at once. So it's something else if you've never been in-center dialysis. So I was fortunate enough to be able to get home hemodialysis. Because peritoneal dialysis, when I switched over to peritoneal dialysis in the beginning, it was a home dialysis method. So the same center also was able to give me a demo at the same time of home hemodialysis. And because I wasn't getting great clearance in hemodialysis, the hours was increasing at a time. The dosage level was increasing at a time by my nephrologist. And I just said, no, I can't do this. This is draining my body. And it was also being, cramping my body more because of more and more fluids. If you're not used to peritoneal dialysis, there's fluid. The bags have different strengths in the bags. So you got to basically know which strength to use. Are you pulling enough fluids? Are you not pulling enough fluids? Do you have enough supply on hand to pull the amount of fluids you want to pull? That sort of thing. So, and the amount of hours, I don't sleep for 10 hours a day. So I really had to make that change and switch over to home hemodialysis. And I bite the bullet, and I said I had to do, because some people are not used to the needles and the 15 gauge needles. I said, I'm going to get used to this. I need something better, something that's going to really clean my blood directly. And doing my own research, I saw that home hemodialysis would be a better solution for me, and why not try it? And so far, it's been much better. I've been much better on home hemodialysis. I've gotten great clearance levels. My labs look great on home hemodialysis. It's also something that I've learned that I can travel with. There is travel cases that I can use if I want to go to travel. There are express bags that I can talk to my center and the manufacturer Next Stage on doing travel bags for me, and also cartridges and supplies that they can ship to where I need it to be traveled, when I need to travel to. So I might just do a trip soon. Never know. I have to do a trip. I'm actually probably doing a trip for work because I'm actually going to do some trips to Albany, some trips to Washington, D.C. I want to see my family. God forbid I don't get to see my family that's currently in, my family is from wonderful island of St. Vincent and the Grenadines. That's where I grew up. That's where I went to school. I have a lot of friends there. And I really want to, if God forbid this might be the last time, that I might be on, I don't know how long I'm going to be on hemodialysis. I really want a kidney transplant. That's the goal, is to get a kidney transplant. But this is the best option for me right now is home hemodialysis treatment, where I can actually travel. They can actually even set up, my center even told me that, my home hemodialysis center even told me that they can set up dialysis at a destination where I want to go, whether it be in center. If I'm there for a week or 2 weeks, they can actually arrange for me to get dialysis treatment at a center at my destination. If I don't want to carry the machine with me and get bags and supplies shipped to the destination, they can arrange it at the center. They will ship they will let the center know where I want to go to in the destination, what my prescription is. They will send over all my necessary information, my medical information, so that the center will have it and know that I am a dialysis patient, home hemodialysis patient, and whatever center I go to, I'm going to let them know that where they're going to stick the arterial needle, because for me, I know where my access is. I can feel my access. I actually do my own cannulation at home, so I know where to stick my needles. I know where to get good blood flow, because in center, if they a lot of in center technicians actually stick you in the same places, and it actually creates these big blood pools or lumps of pools of blood under your arms. And I really want to not have big lumps of blood pooling under my arms, or infiltrations under my arms in my access port. So I really want to be able to direct if I'm doing in-center at any travel destination, or if I'm doing home. I'm glad I'm able to know where and move the needle around to the different areas of my fistula access port. So my machine is finished priming. It's completed. Right now, I'm not gonna do everything right now. I'm not gonna do the connections right now, because I want to keep the pump moving inside my machine for right now, because I need to eat before I get on this machine. So there's a few things I need to do, so make sure my blood pressure is good. I got my supplies ready in the meantime. I have my so I do off packs. So as part of my off pack, I have my band-aids that I once I'm off the machine, I stop the bleeding with my super stoppers to stop the bleeding on my arterial and venous access ports. And after 5 minutes, I put on the band-aids. I also have my 15 gauge needles. These are my 15 gauge needles. Yep. So the red means that's my arterial, and the blue, that means that's my venous needle. So it's 15 gauges in the pack. So when I'm ready, I'll take that out. I have my alcohol prep pads, which it's good cleaning off my access port before I even stick myself. I have heparin. Remember I mentioned heparin? I am a notorious clotter in center and on home hemodialysis. So I have heparin, which I use to, it's an anticoagulant, which used to make me not clot, make me have good blood flow, make sure the machine doesn't clot up, and make sure my dialyzer does not clot in the process and bring a clot into my access port. So you don't want to have clots in your access. That's a very important thing. You do not want to have clots in your access port. Otherwise, you'd have to get the vascular surgeon to clean it out. I had a clot in my access port not too long ago. I had to go back to my vascular access surgeon and had him clean it out. And they do what's called ballooning of the access port. They say they give you medication to numb the area, but yeah, sometimes when they're doing the ballooning, that can be very painful. I can actually feel him going up and down my access port, and I can just feel the ballooning action that's happening inside, and I felt it. It was painful, to say the least. But from time to time, it might happen that you might have a clot in your access port that needs to be cleaned out, and it's not giving you great blood flow. So that's when you need to go back to the access center to get that cleaned out. So heparin is great to make sure that my blood is flowing and there's no clots. What else do I have I have syringes, 10 millimeter syringes that I use to ensure that I have proper blood flow. When I go into my access port, I actually pull blood in and out to make sure of the syringes, to make sure that I have good blood flow. I also make sure I have 10 millimeter syringes, solution syringes. These are 10 millimeter solution syringes that's filled. Uh, that I use to flush my line, mostly just my arterial line. I use it to flush for. I also have two just on hand in case, because it takes a while for you to find the access, put the access in, and sometimes you don't want that clotting to happen. So I flush the line after. I make sure I have good blood flow, so the line doesn't clot. And I actually put the heparin. The heparin goes into my venous line, so I want to make sure it's my, because that's the line that goes into my body. So I want to make sure that it takes a while for me to find the venous line, so make sure that the arterial line is not clotted. So that's why I use the actual solution syringes that I have with the saline syringes. This is my tourniquet. It's used for self-cannulation. For patients that are self-cannulating, I use my tourniquet. As part of the process. I also have here, I also have needle syringes. Needle syringes, this is what I pull my heparin with. So because I have two heparin doses, I mentioned in my previous video, I have two needles that I do. I pull both heparin doses out. I put one in the beginning of treatment and one midway during treatment. So 2.5 milliliters at the beginning of treatment and 2 milliliters at the middle of the treatment. So I make sure to pull those out and have it ready on hand before I start treatment. I also have some gauzes. Sometimes you just need to clean up some blood, or in case you have any leaks or any spills of that nature, you also have to have some gauze on hand, just to make sure you clean that up. Well, could be on your body. I've gotten a few. It happens. Before you get on to start your treatment, you also have to take your temperature. You got to check your sitting blood pressure and your standing blood pressure. So I do a sitting blood pressure, I do a standing blood pressure before I start. I get on to treatment. I also have, as you can see behind me, it's my stethoscope. As part of the process of inserting a needle into my fistula, I actually use a stethoscope. So I put the stethoscope on, and then I check for the thrill access. And you would actually hear the thrill. Access as part of the cannulation process. So, this is what you're trained to do in home hemodialysis training. You're trained to find your access thrill, to find the vein, to feel for the vein, to listen for the thrill, so you actually know where to actually place the needle, to find that good blood access. So what else do I have? I have a scale, so I need to take, weight is very important. So I take my pre-weight before treatment, and I take my post-weight after treatment. So as part of the process, I have a set dry weight. My current set dry weight is 84.5 kilograms. That's my current dry weight. So basically how much fluid whether I drink water, juice, soups, any fluid that goes into my body is kind of retained in my body, because guess what happens? Your kidney is responsible for removing fluid from your body. That's what the whole process of urination is about. Because my kidneys are not functioning as they're supposed to, my body retains a lot of fluid. So that's why dialysis removes the fluid. So I take off kilograms of fluid from the machine. So I set the machine. When I set the machine, I check my dry weight. My dry weight tells me, and my weight tells me approximately how much fluid I need to remove from my body. If I'm at 84.5 kilograms and I'm at 86 kilograms, I might need to take off, 1.5 or something like that, or 2 or point, depending on where I might be at 85 kilograms. I might take a 0.5 or 0.8, only because I get back about 300 milliliters of fluid from the saline solution bag. So you want to go a little bit higher in the process, because I get back that fluid from the machine as part of the whole process. So I don't want to be overdoing it in terms of fluid. I want to make sure that I'm at dry weight, and I'm actually losing weight in the process. So my nephrologist, every month might need to adjust my dry weight as part of my weight loss process. I used to be, when I started dialysis in September last year, I was about 123 kilograms. Do the math in pounds. It's called Google. Do the math. So I've lost a lot of weight. So in that process, I'm now down to from 123 kilograms to so I'm now at 84.5 kilograms in dry weight. Do the math. That tells you exactly how much weight I've lost within the past year. Yeah. So, and right now, thanks to my weight loss goal, my weight loss journey, my health has actually drastically improved in terms of also being treated for severe obstructive sleep apnea, because at that time I would also suffer from sleep apnea, having a sleep apnea machine. And when you lose weight, all that improves because your neck size dramatically decreases. You breathe easier. A lot of things like, I watch what I ate. I'm not eating as I normally should have ate. I normally would eat. Cause trust me, I'm Caribbean. I grew up on stewed chicken, rice and peas, macaroni pie, sauce, callaloo soup. I grew up on it all. So I wanted to make sure I'm eating healthy now. I lost a lot of weight. I'm still on my weight loss journey, my weight loss goal. Last time I checked, I was about 180 something pounds. So my weight loss goal is to be 175 pounds. That's my goal. Don't want to lose any more than that. But that's my goal as part of my weight loss journey. As you can see, I'm a lot skinnier than I was, that you've known me to be. Those of you who are my friends, who follow my channel, who actually know me personally, you would know that I was a lot bigger than this. At one point, I was 270 pounds. So now being at 180 something is remarkable, losing that weight that I've lost. And with losing the weight, some great pluses came out of it from my weight management clinic at my transplant center, because you have to be in a transplant program in New York. So my transplant center, which was, part of my hemodialysis training, is the NYU Transplant Center. I'm at NYU Hospital. It's supposed to be the #1 hospital in the country for transplants, especially kidney transplants. So my transplant center, my weight management specialist, says I am doing great on my weight loss goals. My blood pressure is back to normal. Sometimes it goes below normal, but better than being high. So my blood pressure is doing great. My sugar levels have dropped. My A1Cs are great. So it's been a journey. It's been a journey for me for this past year. getting myself together in terms of learning the whole process of home hemodialysis, just going through the whole peritoneal dialysis and doing a peritoneal catheter, a PD catheter surgery to get it installed and then later removed a few months later, getting a fistula surgery and it got installed by the access surgeon. And starting home hemodialysis training and just learning the whole process of setting up my machine. This is the new Versi HD next stage machine. A lot of people, doing my research, I looked at a lot of videos of people who had the next stage machine. So a lot of their machines are the older versions of the machine. But this is the newer digital version of the machine. So they have the manual versions where you have to actually press the pump, stop. But this one actually is the digital version. Everything is digital. So I'm grateful that I have the new digital version of the Versi HD next stage machine. It does alarm a lot especially when you don't get good blood flow. If the pressure is not right in your arterial axis flowing to the machine. If the pressure is not right in the venous access, it basically tells you everything. So the machine will alarm, it tells you all the alarms and all the codes. And Next Stage has been great in providing the alarm codes and telling you what needs to be fixed on the machine, whether it be the machine or whether it be the actual dialysate pure flow system. So that's it for now. I'll be back when I start setting up the machine, which is setting up the connections for the machine. It takes a while. I got to set up each connection. I got to, set up the dialyzer. I got to set up the waistline, the arterial line, the dialysate lines, so when I set that up, I'm going to be back. I'm going to show you what I do. I hope you're getting a great view of everything, and hopefully I was able to explain as much as I possibly can. If you need further clarification or some further, just let me know in the comment section. I'll be happy to explain even more my hemodialysis process. Whether you need more explanation on my fistula access. There are different accesses that sometimes the vascular surgeon can place. This is a fistula access. There's also what's called a graft. There are patients that don't have big veins, and sometimes they need a graft placed in their arm. There are some patients that actually do nocturnal dialysis and they have a CVC catheter, but then again I don't want to do nocturnal dialysis. I don't want to have the trouble of actually pushing because with a CVC catheter you have to actually make sure there's no clots in the lines of the CVC catheter. You actually have to push heparin in those lines. You have to make sure you keep those lines clean, and again, a CVC catheter leads directly to your heart. And I don't want the, trouble of actually getting an infection that leads directly to my heart. So that is very important. And those are the advice that you would get from your nephrologist, from your doctor when you are having a CVC catheter placed. It's meant to be a temporary access port, and you really have to watch what you do with the CVC. You can't get it wet. You can't get it. All of that. So I am mad about that. As for those of you who know me, Travel with Al is my Instagram Instagram page. It's my Instagram Travel with Al. Subscribe to my Instagram page. I'm going to leave it down in the description below, so you can see my whole travel page, Travel with Al. I like to travel. I like beach. I'm a beach person. And getting a whole CVC catheter and getting it wet and that whole process was not for me. And you know, even with getting the peritoneal dialysis, when you learn, you can actually take a shower, but you can only go in the, you can't go in the pool because you might get, you know, a lot of people being in that pool, a whole bunch of different things. I was just like, and then as soon as I think it was God speaking to me, saying that this is not for you, Alan, because it's not working. Peritoneal dialysis is not working for you, so switch over to home hemodialysis. Much better. Taking my life back, I would say, on home hemodialysis. So I know that this was meant to be a really short video, but it turned out to be a much longer video than I expected. And this is where I'm gonna leave you for now, and then come back to you where in setting up the lines, the connections for my Versi HD next stage home hemodialysis cycler. All right, and with that, folks, I am out. See you in the next video, and I'm out.